Hey guys, welcome back to my channel. So today is my first official day of clinicals. I had 2 other days of clinicals, but one was orientation and then one was some online training. But today I'm actually on the unit shadowing a nurse, and then next week I'm officially doing my own stuff. So I'll bring you guys along. My unit, if you're wondering, is respiratory / GI / GU. Last year I was on a rehab medicine, and I'm in my BSc in year 2 program, if you're wondering. So I already did my makeup. I just did a really natural thing with purple eyeliner and pink. But yeah, this is what it looks like. Really well, not natural, but natural for me. And I already packed my clinical bag. If you guys want to see a video of what's in my clinical bag, then just leave a comment. But I'm just getting ready to go. I don't want to go too early, but not too late. So I'm just waiting for the perfect time to head out the door. It's a long drive. I think it's 40 minutes from my house. So yeah, and by the way, it's I think 6 a.m. now. I woke up at 4:30 around that time. So yeah, that's my life. So this is my outfit. This is from Poland. It's from Bershka. I got it last year. I don't know if it's still available. And then these pants are from Champion. I just got them. So.
Hi there, thank you for choosing Starbucks drive-thru. What can I get for you this afternoon?
Hi, can I get a venti pumpkin spice latte?
The venti pumpkin spice latte. Anything else for you this afternoon?
No, that's it.
Alright, that's gonna be $6.38. I'll see you at the window.
Thank you. Hey guys, so I finished my placement 40 minutes ago. It's now 4:15 and I'm waiting for my Starbucks. I was gonna get McDonald's because I'm too broke for Starbucks, but I decided to reward myself again. But I'm gonna update you guys about what my clinical experience was when I get home after I get my drink. Okay, I'm back and I have my pumpkin spice latte. So good. So I'm gonna tell you a bit about my placement. So I got back just now. I had dinner. But basically, I went through a bunch of patients. I'm happy that I didn't just stick to one, so I was able to see a wide range of different diseases and things that they had that you see in textbooks but you never see in real life. For example, my patient had lots of lesions all over her body, and you would think of cuts, but the type of lesions that she had, I don't think I've seen before. At least I don't remember. So it was a great experience to just see different things that I see in textbooks but are in real life. Also, they also had edema, pitting edema of 2+, and that was really cool too because we spent so much time learning about edema in different courses. So we learned about in an assessment class and in anatomy class. So it was really cool to finally see what it looks like in real life. And also my nurse was so nice. I am so grateful that I had her today as my first nurse that I shadowed and I went through things with. So that was really cool. Yeah, basically the team was really nice that I talked to, and I did a lot of stuff. I was busy almost the entire time except when I was charting, and then right after charting I was waiting for my CI to come and look at my charting just to make sure that I did everything correctly. I'm not submitting it and it's all wrong, or if I didn't remember something, then she helped me to put it down on the charting. But yeah, so that was my experience. It was really good overall. I'm so excited for next week. Hopefully I have a good nurse too. So I'm also gonna describe some things that I did today. So unlike last year, I didn't do any bathing or any feeding, and that's fine because I did work as a PSW over the summer. But I did a actual first official physical assessment. So I went through everything: neurological, muscle strength, her lungs, like basically everything. So that was really good practice. It was a great refresher also to kind of, you know, take a look at like what I learned last year, because over the summer I didn't really review, so I didn't really remember about all of these assessments that we were taught. What else did we do? I did a lot of pericare, and then I answered some calls that we had, and then we had a debriefing session after. So for an hour basically we had some time to kind of discuss about our experiences, and then we watched a video on how to do a physical assessment, just to not only have that I guess you could say physical experience, but we will also refresh with I guess the official way to do a physical assessment on through this video. So we watched that. That was pretty, like 15 minutes. It was pretty long, but yeah, it was interesting to hear also about my group's different patients, because I did go to quite a few patients, maybe I would say 5, but there were still a lot of patients on the unit that I didn't see, so it was really interesting to hear their stories and how their day was. So that was basically my experience. It was overall very good, especially because of the clinical team that helped me. So the clinical instructor and then the nurse that was working with me, and also the people in my group were really nice too, and they helped me out. So that was really good, and I'm so grateful for that, because last year, although they were pretty nice, I feel like there were more people, at least in my experience, that were rude there. There were really nice people, like I said, but not everyone was nice. But here, everyone I talked to was really helpful, really nice. If you needed help, they were right on it, and they really appreciated your own help, which is so nice, because as a nursing student, making them happy about helping them and they actually like express their gratitude for you helping them is the best feeling, because there's not that many places where people will be that nice to actually thank you and appreciate what you're doing for them. And I think that that's what they did here, and it was the best feeling. So I really liked it. I am so excited to go back next week, but I do know that I have to review quite a few things, just so I'm on top of my stuff next week, so that I don't look dumb, or like I don't forget anything that's like kind of obvious. But yeah, I have one exam coming up next week, so I need to study for that today. I need to also take a shower, because after I'm in somewhere, especially there were lots of patients that were contact precautions, and that's the majority of patients that I want to visit. I'm gonna take a shower, wash my hair, and then probably just study for patho and my practice class. So that's my day today. It's not very interesting, and then I'm gonna try to get to bed sometime today, because I have to wake up at 4 a.m. tomorrow, because I'm not driving to my school. I'm gonna take the train, just because I think me and my friend are gonna review for some classes tomorrow evening, and if I drive, then I have to pay extra parking, and that's gonna be just an excessive amount to pay, so I'd rather just take the train tomorrow. So yeah, that's my day. I'm gonna walk with my dog, but just appreciate the total transformation of me from the last clip. Like, how cute. But yeah, I'm just taking my dog on a walk because he's feeling sick, so maybe he'll feel better after this. He's such a cutie. Look at him. Hi. He's visiting every tree as usual. It's his favorite thing.